Well, I work for the League of Minnesota Cities. I'm the HR director. I've been here over 22 years.
I'm an HR manager at the League, been with the organization for almost 26 years. And we serve cities throughout the state of Minnesota, provide services to them. We lobby for them at the Capitol. We provide insurance, workers' comp, general liability, property casualty, and a whole host of services that help our cities do their jobs.
We've been in the Sourcewell healthcare pool for quite a few years now. We really enjoy being there with other public entities. That's really important to us.
It's always good to keep the costs down, but you have a team at Sourcewell that's working on your behalf. They have the health insurance background, so they're doing all of the legwork for the insurance plans.
Well, I like the fact that they go out for bid frequently. I like the fact that they pay attention to trends and innovations, offer different kinds of programs.
But yet, as they're doing that, they're always seeking input from members. They're looking at what do our members want and what do our members need.
One of the biggest selling points, I would say, though, is their wellness program. The League has been trying to build a culture of wellness for many, many years now.
Wellness is very specialized coverage or option to have for employees, and it's very time consuming, and there's so much to know about it.
I think the Sourcewell attention to wellness has given us that added boost that we've need to really get our employees on board and really get them thinking about wellness. And I know it's working. We've seen evidence that it's working.
Our department had a long history of you want something from tech and you want to treat them right, you bring chocolate down or you bring donuts down. Right after Bill started, all of a sudden we said, hey, you want to do this? And the answer was no. It kind of took a few of us back and we're like, wow. It got to the point where several months ago, somebody brought down donuts and then we moved them off into the lunchroom and we're like, free donuts, everybody else, because nobody in the department really wants that type of nutrition anymore.
You can have all the support you need at home, but a lot of times you end up spending your day with a lot of people who you just kind of by happenstance end up spending your day with. So the fact that the culture at the place where you spend your day is set up to support wellness, I think is pretty important.
I think the other piece to that is not so much having the wellness incentive, but having a veritable plethora of programs available. I probably wouldn't have made it as far as I did without that support through my health plan, through the OMADA program, through getting the free scale, who is my frenemy.
It's about slow, small changes that are sustainable for an entire life that you can say, okay, generally speaking, I'm going to behave like this, eat like this, exercise like this, move like this the rest of my life.
I'm down 40 pounds. And I just had my annual physical, and for the first time in 10 years, the doctor looked at me and he said, whatever you're doing, keep doing it. Your blood work is better. Your weight is looking great. Keep doing it.
Well, for me, over the past 2.5, almost 3 years, I'm down, as of this morning, 205 pounds, about 20 inches off my waistline.
We've lost over 300 pounds as a department.
You know, we've had an incentive program for our employees for quite a number of years, but again, Sourcewell took what we had and built on it and boosted it and made it even more impactful. So our employees are getting some pretty nice little perks associated with keeping well.
In the WellRight portal, I think I was the most excited about the Walk There Challenge that has recently taken place, and it happened during COVID. That challenge, we had the most participation that we have ever had with our employees in a wellness event.
Some people had amazing step counts, and I did my part. I was walking during in-person meetings trying to get my step count up, and we were all doing our best, but Brainerd took the day. What can I say?
Some of the feedback that we got from some employees is the anxiety that COVID was causing. Being a participant in the Walk There Challenge reduced that anxiety and stress for them, and it helped them feel connected to their colleagues as well as our members.
Well, we're fortunate to have Danielle Mikosevich serving on one of your boards, and she's very active.
Serving on the executive committee has been a huge learning opportunity for me, and I would encourage cities, school districts, and others to consider serving on there. You have a say in the coverage and types of insurance that are being offered to your employees. And if you are concerned about health insurance costs increasing by serving, you have the opportunity to try and keep those down. Bring your ideas, and that's what we want. We want input from members of the pool because this is your insurance. This is your health insurance pool, and you can have a say in it. It excites me now to talk about it and to be able to bring exciting offerings to our employees.